Good day to all of you. For today's topic, I am going to discuss the vital signs. For the overview, vital signs is a common, non-invasive physical assessment procedure that most clients are accustomed to. So pag sinabing vital signs, we have five components. You have the temperature, you have the pulse rate, respiratory rate, blood pressure, and pain or pain assessment. So siguro naman lahat tayo as a being, 'di ba, na kapag pakuha na ng vital signs. Every time na may pupunta tayo for example sa hospital, 'di ba? A healthcare provider or healthcare professional tend to get our blood pressure. So that is one of the components of vital signs. So ito yung alam na alam ng almost all people, and this is a non-invasive procedure, meaning very simple lang siya na magawa sa ating mga pasyente. So it provides data that reflect the status of several body systems, including but not limited to the cardiovascular, neurological, peripheral, and respiratory system. So somehow, when we take the vital signs of our patients, it provides us an overview of this system. Nakikita natin yung somehow the status of the cardiovascular, neuro, peripheral, and respiratory status of the patient. So, kaya siya tinawag na vital signs, definitely, ito ay ang mga senyales na vital or mahalaga sa buhay ng isang tao. So we measure the client's temperature first, followed by pulse, respirations, and blood pressure. So ito yung chronological order usually sa pagkuha natin ng vital signs. Why temperature first? Because measuring the temperature puts the client at ease and causes him or her to remain still for several minutes. So this is important because pulse, respirations, and blood pressure are influenced by anxiety and activity. So kumbaga, inuuna natin sa temperature para ma-relax, para maging comfortable yung pasyente natin. Because kung siya ay anxious or hindi siya comfortable sa kanyang sa ginagawa natin sa kanya, so magkakaroon ng alteration sa pagkuha natin sa kanyang respiration, blood pressure, and pulse. So mahalaga na si client or si patient is comfortable and relaxed. That's why we take first the temperature. Now, what are the different purposes for taking vital signs? First is to obtain baseline data. Definitely, when we take the vital signs, magkakaroon tayo ng baseline information from our patient. So that kapag bumisita uli siya or kapag gusto nating i-monitor yung kanyang uh, development or progress sa kanyang health status, meron na tayong pagko-comparean. Okay, so that is the vital signs. Second, to detect or monitor changes in the client's health status. So kagaya na sinabi ko, we compare the status of the patient like before and after. So tinitingnan natin kung may progress or may magandang development sa kanyang kalusugan. If he or she is, for example, ill or merong disease. Number three, to monitor clients at risk for alteration in health para makita natin definitely kung sino yung may alteration or yung may problema sa kalusugan. So makikita natin pagka may abnormal sa vital signs ni pasyente, so we can somehow see na itong pasyente na to ay suffering from a certain illness. So these are the purposes of vital signs. Now, when do we take vital signs? So kailan tayo kumukuha ng vital signs sa ating pasyente? First is upon admission, or for example, upon our initial encounter to our patient, kapag kumukuha tayo ng objective data, di ba? During our assessment, so kinukuha natin itong vital signs ng pasyente. Okay, so upon admission, changes in the status of the patient, nursing or medical order. So for the medical order, for example, si doctor ay gustong ipamonitor yung pasyente na, for example, serious yung illness. So gusto niyang ma-monitor yung vital signs ng pasyente every, for example, 1 hour. So if that is the case, then we take the patient's vital signs every hour. Okay, so that is another um, way or reason why we or when do we take vital signs to our patient upon doctor's order. Before, after, or before, during, and after invasive procedure para makita natin. Kasi invasive procedure yung gagawin. So definitely, we have to get again the baseline data so that mako-compare natin yung vital signs ni pasyente before, during, and after the procedure. Ganon din sa administration of drugs so that we can see kung may pagbabago ba sa vital signs ni pasyente. So we take his or her vital signs before and after the administration of the medications. And then before and after any nursing intervention. So this is when we take our patient's vital signs. And now we are going to talk specifically temperature first. Okay, so when we say temperature, this is the balance between the heat produced by the body and the heat lost from the body, and it's measured in heat units called degrees. So it's either degree Fahrenheit or Celsius. So again, pag temperature, this is the heat produced by the body and the heat lost from the body. Now, we have two kinds of temperature. First, you have the surface temperature. So this is the temperature of the skin, subcutaneous tissue, and fat. So meaning parang superficial yung ating surface temperature. So it fluctuates in response to the environment. So mahalagang factors sa environment when we are referring to surface temperature. It significantly influence the surface temperature. So the other type is core temperature. When we say core temperature, this is the temperature of deep tissue of the body, such as your abdominal or pelvic cavity. So this is our core. Ito yung core temperature samples natin sa abdominal and pelvic cavity. So these are the two kinds of temperature, surface and core temperature. Now, what are the different factors naman affecting body temperature? First is age. So for infants, they are highly responsive to changes. So depending on the environment, kung malamig, kung mainit, so they are responsive to the temperature of the environment. So definitely magva-vary yung kanilang temperature depending on the environment. So for older adults naman, they are at risk for hypothermia. Kasi when we get older, di ba, yung mga body fats natin somehow is nawawala. So if that is the case, yung mga elderlies natin, yun na nga, they are at risk for developing hypothermia or yung pagbaba ng temperature kasi nga wala na masyadong nag-insulate sa ating katawan. Diurnal variation, so this is the temperature throughout the day. Okay, for example, the temperature is at highest during the time of 4 to 8 p.m. Okay, and then lowest during 4 to 6 a.m. So, take note of this because somehow may influence to sa temperature ng ating mga pasyente. Exercise, so definitely kung kagagaling mo lang sa exercise or sweating, you have a higher temperature. Hormones, it raises body temperature by about 0.3 to 0.6 degrees Celsius above basal temperature. That is most especially to girls. For example, they are ovulating. Stress naman, the release of epinephrine and norepinephrine, it increases metabolic activity and heat production. So if you are stressed, definitely, you have an increased body temperature. And then environment, extremes in environmental temperatures can affect a person's temperature regulatory system. So yung paligid natin definitely has an influence in our temperature. Now, these are the different terms naman that refers to the alterations in body temperature. We have first pyrexia, hyperthermia, or fever. So when we say When we refer to these terms, pyrexia, hyperthermia, or fever, we refer to the body temperature above the usual range. So, ibig sabihin, it is above normal. So, that is pyrexia, hyperthermia, or fever. Now, specifically, we say febrile if our client or patient has a fever. So, febrile. On the other hand, afebrile naman sila, the one who does not have fever. So kung wala kang lagnat, afebrile yung tawag natin. So next, hyperpyrexia or very high fever. So this is an extreme high temperature, extreme high fever, um, such as 41 degrees Celsius or 105.8 degrees Fahrenheit. So yung kanina, pyrexia lang, that is above normal, pero kapag ka-extreme yung taas, such as 41 degrees Celsius, that is hyperpyrexia na. Okay, so next we have hypothermia. So hypothermia naman, this is body temperature lower than 36.5 degrees Celsius or 96.0 degrees Fahrenheit. So it may be seen in prolonged exposure to the cold, hypoglycemia, hypothyroidism, or starvation. So that is hypothermia. On the other hand, ayan, yun nasa picture, it is hyperthermia, a body temperature higher than 38 degrees Celsius or 100 degrees Fahrenheit. So it may be seen in viral or bacterial infections, malignancies, trauma, and various blood, endocrine, and immune disorders. So yun yung magka-opposite sila, si hypothermia and hyperthermia. Now, so in here, we have the different sites in taking temperature to our patients. And then, ano yung advantage and disadvantages. So let's start. So let's start. Site for temperature measurement. First is oral, meaning sa ating oral cavity ng pasyente. So the normal range para pag tayo ay kukuha ng temperature in the oral cavity is 36.5 to 37.5 degrees Celsius. So this is the usual range kapag oral temperature yung kinuha natin sa pasyente. So advantage, this is accessible and convenient. And then for the disadvantages, thermometers break if bitten, baka makagat ni pasyente. So definitely it might get broken or baka masira. And then inaccurate if the client ingested hot or cold food, fluid or smoke. So kung kakakain lang ni patient ng mainit, kainom lang ni patient ng mainit or malamig, so definitely makaka-apekto yun sa ating reading. And then it could injure the mouth following oral surgery. So that's the first oral. Second is rectal. The normal range is 37 to 38.1 degrees Celsius. So, reliable measurement si rectal. So, ito siya like sa bata. Now, what are the disadvantages? Definitely, this is inconvenient and more unpleasant for clients, especially kung na-edad na, di ba? So, it is difficult for client who cannot turn to the side. It could injure the rectum following rectal surgery. So, definitely, hindi natin ginagamit yan kapag nagkaroon ng rectal procedure sa pasyente. And then, if there is a presence of stool, If there is a presence of stool, it may interfere with thermometer placement. So that is the first two, oral and rectal. The third one is the axillary. Ito yung sa kilikili. 35.8 to 37 degrees Celsius is the usual range. That is the normal range for axillary. Advantage, it is safe and non-invasive, and this is the most common, see axillary. The disadvantage lang is that thermometer must be left in place a long time to obtain an accurate measurement. And then the fourth one is the tympanic membrane. The normal range is 36.8 to 37.9 degrees Celsius. Advantage, readily accessible siya. It reflects the core temperature. So kagaya na discuss natin, di ba, we have surface versus core. So si tympanic, it reflects the core temperature, meaning like the inner temperature of the patient. and it is very fast. So mabilis lang si tympanic. Now, what are the disadvantages? It can be uncomfortable and involves risk of injuring the measurement if the probe is inserted too far. Kaya dapat we have to be careful in using this route for taking the patient's temperature. Repeated measurements may vary, right and left measurements may differ. And then the tool itself or the equipment itself is very expensive. Okay, so yung kanina, si axillary is like very ano naman, this is the most common at inexpensive somehow yung ginagamit natin in the equipment in getting the temperature for axillary compared to the tympanic. The fifth one is the temporal artery. So the advantage is it is safe and non-invasive and very fast then. For the disadvantage, it requires electronic equipment that may be expensive or unavailable. Variation in technique needed if the client has perspiration on the forehead. So this is the fifth, the temporal artery. Okay, so here sa aking succeeding slides, pinakita ko dito another figure lang on how do we place the different um, equipments na ginagamit natin and different routes na ginagamit natin for taking our patient's temperature. So you have the oral, you have the rectal, axillary, the tympanic, and the temporal. So may additional details, kindly read this slide for more information. And then I just included here yung skills or yung checklist in getting the temperature. Later, I will discuss to you yung checklist na gagamitin natin. Kasi sa checklist na gagamitin natin, we are just going to use one checklist for getting all the vital signs. In this case kasi, one checklist for each vital sign. Pero in our case, we only have one checklist for all the vital signs. Kaya mamaya, i-discuss ko yung checklist natin na gagamitin. So I just place it here for your information or for additional details of the topic. Okay, so this is the checklist on how we assess body temperature. Again, FYI. So kindly read for more information. Okay, next we have pulse. So we are done with the first vital signs or VS kung tawagin, and that is temperature. The second is pulse. So let's talk about pulse rate or pulse. So a pulse, a shock wave is produced when the heart contracts and forcefully pumps blood out of the ventricles into the aorta. So the shock wave travels along the fibers of the arteries and is commonly called the arterial or peripheral pulse. So ito yung pulse na nararamdaman natin sa ating pasyente kapag kinuha natin yung kanilang PR or pulse rate. So that is because of the contraction of their heart. So the body has many arterial pulse sites. So actually marami tayong pwedeng pagkuhanan ng PR or pulse rate sa ating pasyente. We have many pulse sites. So one of them, the most common, is the radial pulse. It gives a good overall picture of the client's health status. Several characteristics should be assessed when measuring the radial pulse, and this includes the rate, rhythm, amplitude, and contour, and elasticity. So this is the radial pulse. This is how we take the pulse rate or PR of the patient using the radial pulse. Now, the amplitude can be quantified as follows. So, pwede nating i-document yung amplitude using this numbers. So, 1 plus, that would mean na thready or weak yung pulse. It is easy to obliterate. 2 plus or 2 tapos plus sa taas, normal, obliterate with moderate pressure. And yung 3 is the bounding pulse. So, unable to obliterate or requires firm pressure. Okay, so if abnormalities are noted during assessment of the radial pulse, further assessment should be performed. So, dito-document natin yung nakukuha nating pulse rate. And again, to document the amplitude, ito, 1, 2, or 3. Okay, so it depends on your institution kasi I have seen other references na yung kanilang documentation for the amplitude is up to number 4. So you have to refer to your institution kung ano yung guidelines nila when it comes to documenting the amplitude of the pulse taken. So pwedeng some references ito yung ginagamit niya. So 1 is for thready or weak, 2 is for normal, and then 3 is for bounding. So again, refer to your institution or agency protocol. Okay, so next we have the factors affecting pulse rate naman. So what are the different factors that affect the pulse rate of the patient? For the age, the younger the person, the higher the pulse rate. So kung mas bata, mas mabilis yung tibok ng kanilang pulse. Gender, after puberty, females are greater than males. Okay, so for the gender, usually sila males yung mas mabilis. However, after puberty, mas bumibilis na or mas bumibilis yung sa females, okay? So again, after puberty, females have higher or greater pulse rate compared to males. This is because there's a the difference is largely accounted for by the size of the heart. So, ibig sabihin, mas smaller yung heart ng mga babae, ng females, kaya naman, mas kailangan mag-compensate by um, mas mabilis yung pagtibok ng kanilang pulse rate in comparison to the male's heart rate. Okay, so the smaller female heart pumping less blood with each beat, it needs to beat at a faster rate to match the larger male heart's output. Okay, so in general, this is in general naman. Ano? So, again, mas mabilis yung tibok ng puso ng mga babae after puberty in comparison to the men or males. That is for the gender. So, you have to take note of that again. Mamaya, I will show you naman the normal range or the usual range of pulse rate for both men and women. So, that is for the gender. Next, exercise and fever. Definitely, if you are exercising or if you have fever, mas mabilis yung tibok ng puso. Medications such as digitalis, beta blockers, it decreases pulse rate. While epinephrine and atropine sulfate, it increases pulse rate. So kung umiinom ng medication sila patient, so definitely tignan ninyo baka it affects naman pala their pulse rate. Kaya for example, mabilis yung tibok ng puso nila, baka nag-epinephrine pala kasi siya or nagtitake ng atropine sulfate. So we take note of the medications being taken by the patient. Hemorrhage, so definitely increased pulse rate as compensation for blood loss. So kung may bleeding si pasyente, so mas mabilis yung tibok ng puso to compensate for the blood loss. Stress, sympathetic stimulation increases the activity of the heart. So if you are stressed, mas mabilis din yung tibok ng puso mo or ng iyong pulse rate. Position changes in sitting or standing position, there is a decreased venous return to the heart, decreased blood pressure, which is equivalent naman to increased pulse rate. Okay, so kapag bumababa si blood pressure, for example, you are in a sitting or standing position, so si heart ay magko-compensate by increasing the pulse rate. Okay, so if in general, you are changing your position. Kasi nga, bumababa si BP because there is a sudden, for example, decrease in the venous return of the heart. One good example, for example, you are lying or in supine position tapos bigla kang tatayo or magsi-sit down or you will change position suddenly. So, the blood pressure will decrease and the heart will compensate by increasing the pulse rate or the heart rate. So mamaya malalaman natin what is orthostatic hypotension. So that is the case. Okay, so those are the factors that affects pulse rate. So you have to take note of that or of those things kapag kumukuha ka ng PR to your patient. Now, what are the different terms na ginagamit natin sa pulse or in the pulse rate of the patient? So, pag sinabing peripheral pulse, it is a pulse located away from the heart, for example, in the foot or wrist. So, kumukuha tayo sa peripheral pulse ng pasyente when we are using the radial pulse. So, that is the wrist. Apical pulse, in contrast, is a central pulse. So, yung pulso sa puso natin, so that is the apical pulse, and that is a central pulse. So, that is located at the apex of the heart. So, it is also referred to as the point of maximal impulse. So, apical pulse, so ito yung pinaka central pulse natin, and that is in the or at the apex of our heart. An excessively fast heart rate, for example, over 100 beats per minute in adult is referred to as tachycardia. Remember that term, tachycardia, heart rate over 100 beats per minute in adult. A heart rate in an adult of less than 60 beats per minute naman is called bradycardia or bradycardia. So opposite ng tachycardia is bradycardia. So that is a heart rate or pulse rate of less than 60 beats per minute in adult. So if a client has either tachycardia or bradycardia, the apical pulse should be assessed para mas ma-ensure natin na tama or accurate yung nakukuha nating heart rate or pulse or the pulse rate of the patient. So mas nagre-refer tayo sa central pulse para mas accurate yung nakukuha natin. Especially if again, bradycardic or tachycardia yung ating nakukuha sa ating pasyente. So the pulse rhythm is a pattern of the beats and the intervals between the beats. So equal time elapses between beats of a normal pulse. So that is the pulse rhythm. And then a pulse with an irregular rhythm is referred to as dysrhythmia or arrhythmia. So ito yung mga abnormal na in terms of the rhythm of the pulse rate or the heart rate. Okay, so kagaya na sinabi natin, there are many pulse sites na pwede natin pagkuhanan sa ating pasyente. So, the most common definitely is the radial pulse here, radial pulse, and the brachial pulse. So, other parts, we have here the carotid. Okay, dyan sa ating neck. Then you have the temporal. You have the femoral sa bandang singit, popliteal sa ating back of the knee, posterior tibial, and then dorsalis pedis. And then here's another another illustration showing the pulse sites. Temporal, carotid, apical. Ayun, apical, again, that is a central pulse. That is our heart mismo. Brachial, and then radial, and then femoral, posterior tibial, dorsalis pedis, and then you have popliteal. So, kayo guys, try nyong kapain yung different pulse sites na yan for you to know. Okay? And then, again, definitely, the usual part na kinukuha na natin ng pulse rate kay patient is the radial and brachial. Okay? And then, definitely si apical, this is, kung gusto nating accurate talaga yung makuha natin. Okay, so ito na yung ating pulse rate beats per minute, the usual range depending on our client's age. So for newborn, the pulse average is 130 and the range is 80 to 180. For 1 year, so mas mabilis definitely sa mga bata. Kagaya nga sa kaninang diniscuss natin na factors, di ba? For 1-year-old, 120 is the average. The range is 80 to 140. And then, dito na lang tayo pumunta sa teens, for example. The average is 75. The usual range is 50 to 90. And then for adult, the average pulse is 80. The usual range is 60 to 100. So kung makakuha ka, for example, ng 62, 63, or 99, 98, so within normal pa yan, or within the average for older adult. Pero kapag ka sa, for example, sa ibang age bracket mo siya kinuha, you have to check yung kanyang usual or kinompare. For example, ang nakuha mo sa bata ay around 50 lang. So although okay lang siya for 10 years old and for teens, yung 50 na bilang na pulse rate. Pero pag iyon ay nakuha mo sa newborn, so iyon ay bradycardia na, mabagal na. Kasi the usual range for newborn is 80 to 180. Okay, so that's the reason why na dapat alam natin yung normal range for the specific age bracket. So take note of this. And then again, I just included the checklist or the skills checklist on how to assess a peripheral pulse. This is for your information. Again, what I will be discussing is our checklist na gagamitin for your return demonstration. So this is again, it's just an additional information for you to read. Okay, so the third vital sign is respirations or respiration or the RR, respiratory rate naman ito. So respiration is the act of breathing or ventilation. So we have here several terms again. So inspiration or inhalation, this is the intake of air into the lungs, while expiration or exhalation, this is the breathing out of gases into the atmosphere. Now we have two types of breathing. So basically itong inhalation or inspiration, ito yung paghinga, you inhale, and then expiration or exhalation, ito yung pagbuga ng hangin. So the exhalation. Okay, so inhalation and exhalation. So that comprises our respiration or the act of breathing. So there are two types of breathing, costal or thoracic. It involves the movement of the chest. And then the other one is diaphragmatic or abdominal. It involves the movement of the abdomen. Now, this is the rate. So, ang count, by the way, yung counting natin or yung unit na ginagamit natin sa pagka-count ng pulse rate natin is beats per minute. Okay? Either heart rate man yan or pulse rate. Dino-document natin yan. For example, ang nakuha natin is 80. So, ang unit is 80 beats per minute. BPM. 80 BPM. BPM means beats per minute. While for respirations or the respiratory rate naman, we document the unit or yung nakuha nating respiration as cycle per minute. Or pwede rin siyang breaths per minute. Okay, cycle per minute, CPM or breaths per minute. That is for the respiratory rate. So this is the usual range for newborn. The usual RR or the respiratory rate is 30 to 80. So that is the normal range for newborn. 1-year-old is 20 to 40. And then dun tayo sa teens, 50 to 20. Adult is 12 to 20. Older adult is 15 to 20. So again, you take note kung ano yung normal para sa age bracket na yon. Kasi magkakaiba tayo ng range of, the normal range per age bracket. So the rate, it is described as breaths per minute or BPM. Kagaya na sinabi ko. Now, what are the different terms pa na associated for respiration? You have eupnea. Eupnea, that is a normal respiration. Eupnea. Tachypnea, this is a fast respiration, meaning above the normal sa usual range na meron tayo. For example, for older adult, ang nakuha mo is 22. So, tachypnea yung ating pwedeng ma-term doon if that is the case. Okay, so That is a fast respiratory rate for adult kapag 22. Tachypnea. Bradypnea, this is slow respiration naman. For example, for teens, ang nakuha natin is like 11 RR or 11 cycles per minute. So that is bradypnea. Ibig sabihin, less than normal yung nakuha natin sa kanya. Less than the normal range. And then apnea, this is the absence of breathing. Again, apnea is the absence of breathing. Wala nang paghinga, that is apnea. Now, these are the other terms related to breathing or respiratory or respiration vital signs natin. So, tachypnea, nasabi na natin, bradypnea, and apnea. Volume, when we're talking about the volume, we have hyperventilation. This is the overexpansion of the lungs characterized by rapid and deep breaths. So, pag sinabi nag-hyperventilate yung pasyente, ibig sabihin, rapid and deep yung kanyang breathing. Pag sinabi namang hypoventilation, nag-under expansion yung kanyang lungs na characterized by shallow respirations. So, kabaliktaran siya ni hyperventilation. For the rhythm, mamaya we will see the Kind-Stokes breathing on the next slide. Nandoon siya. For the ease or effort, dyspnea, this is difficult and labored breathing. So, pag sinabi mong, yung pasyente mo is experiencing dyspnea or dyspneic si patient, ibig sabihin nahihirapang huminga. Orthopnea, this is the ability to breathe only in upright, sitting, or standing position. Nahihirapan siyang huminga kapag nakahiga na. So that is orthopnea. The audible without amplification, the breath sounds, stridor, stertor, wheeze, and bubbling. So kindly read for further information. And then the other terms pa na associated sa breathing patterns and sounds. So, dito, ipapakita ko lang yung rhythm for the breathing pattern na meron pa tayo in terms of the rhythm of the respiration. So, we have the Kind-Stoke here. Ito yung picture niya or the GIF. So it's characterized by very deep, tapos very shallow, and then with apnea. So, yung huminga si patient ng malalim, and then very shallow din, and then with periods of apnea. So, nawawala. Pagka, halimbawa, nag-breathe siya very deep, and then tapos magiging very shallow, tapos a period of apnea. So, just like this in the video. On the other hand, pag sinabi namang Cosmos breathing, just like this one, sa GIF natin, so rapid, deep, labored breathing. So, that is Cosmos breathing. So, mabilis na malalim, tapos labored. Kita natin na hirap siyang huminga. So, that is the Cosmos breathing. And then Biot's breathing naman. So, it is a shallow breaths interrupted by cluster of apnea. So, those are the rhythms in terms of your breathing pattern. Now, how to count your respiratory rate or the RR? So, the RR and character are additional cues to the client's overall health status. So, respirations can be easily observed without alerting the client by watching chest movement before removing the stethoscope after you have completed counting the apical beats. So, in this case kasi, gumamit daw siya ng stethoscope to count for the heart rate. Okay, so pwedeng you can assume, for example, binibilang mo pa rin yung kanyang heart rate using the stethoscope, pero you are checking na talaga yung kanyang respiratory rate. So you are taking note of the chest movement of the patient. Isang inhalation and isang exhalation, one count yun ng respiratory rate. So in this figure, in this image, the nurse is just using the radial pulse of the patient. So, nagkukunwari lang tayo na, although tapos na tayo, for example, na bilangan yung pulse rate, pero we are like acting na binibilang pa rin natin para hindi maging conscious or maging aware si patient na ang binibilang na natin is the respiratory rate. Kasi again, if they are aware, or if they are anxious or if they are conscious na binibilang natin yung kanilang respiration, pwede kasi ma-alter yun. So, that is how we count the respiratory rate of the patient. Okay, so we check for the movement of the chest of the patient, the rise and fall of the chest. Okay, so again, one inhalation and one exhalation, isang count yun ng respiration or the respiratory rate. Again, I have included here for your information the checklist in assessing respirations. So, for more information ito sa inyo. Okay, so nakatatlo na tayo. We are done with temperature, we're done with pulse rate, and we're done with the respiratory rate. So the fourth one is the blood pressure or BP. So BP or blood pressure reflects the pressure exerted on the walls of the arteries. It is the force of blood exerts against a vessel wall. So just like this one. Okay, so ayan, the heart is contracting and then that is the force exerted in the vessel wall. So we have terms, systolic pressure. This is a pressure of blood as a result of contraction of the ventricles. So again, systolic pressure, just like in this GIF, that systolic pressure, yun yung pag-contract ng ventricles of the heart. While yung diastolic pressure naman, this is the low pressure as a result of ventricular relaxation. So, pag nag-relax na si ventricles, so diastolic pressure na yun. Pero pag nag-contract si ventricle, that is the systolic pressure. So, makikita nyo. So, ventricles contract, ayan, systolic pressure yung reading. Pero pag ventricles relax, diastolic pressure na siya, just like this one. Now, factors that influence blood pressure, the age, exercise, stress, race, obesity, sex, medication, and diurnal variation. So these are the factors that you have to consider. Mamaya, I will show you again the usual range for the age bracket when it comes to the blood pressure of our patient. Again, dapat alam natin yung normal range for a certain age bracket. So alterations in blood pressure, so these are the terms, hypertension. It means abnormally high blood pressure over 140/90, confirmed by a minimum of 2 consecutive visits. So again, hypertension kapag yung reading natin ng blood pressure is over 140/90. Okay, so that is hypertension. Hypotension naman, abnormally low blood pressure naman below 100 millimeters of mercury, yung systolic pressure. Or pwedeng between 85 to 100 millimeters of mercury yung systolic pressure na reading natin. So that is hypotension. So ito yung orthostatic hypotension na nasabi ko. So it is a blood pressure that falls when the client sits or stands. Or to be more accurate, when a patient or a client suddenly nag-change ng position, like kagaya ng sample ko kanina, from a lying position or from a supine position, nag-change siya into a sitting position, so definitely, there is an alteration sa ating blood flow. And if that is the case, nagkaroon ng orthostatic hypotension yung ating pasyente because sudden yung change ng ating blood flow because of the gravity yon. So, ang ina-advise, that is temporary naman. So what we advise is definitely when you change your position, like from supine to a sitting, dapat dahan-dahan lang to prevent orthostatic hypotension. Now, this is the classification of blood pressure or so yung kanina na hypertension and hypotension, that is the general term. Okay, para masabi, these are the terms na ginagamit natin kapag abnormal yung blood pressure. Baka napag-mix ko na yung terms. Blood pressure, pagka abnormal yung nakuha nating blood pressure sa ating pasyente. So, it's either hypertension or hypotension. Now, ito yung mga classification of blood pressure in millimeters of mercury. Normal, again, is less than 120 or greater than 80 yung diastolic, or the average is like 120 over 80. Okay, so that is the normal category. 120 over 80, that is the usual. Okay, so next you have pre-hypertension 120 to 139. Yung systolic BP, while for diastolic naman is 80 to 89. Hypertension stage 1, 140 to 159 yung systolic blood pressure, diastolic is 90 to 99. And then, so nakita nyo mataas, okay? Significant yung taas ng blood pressure as we go sa higher stage. And then hypertension stage 2, the systolic blood pressure is more than 160 millimeters of mercury and the diastolic is more than 100. So for example, 165 over 110 yung kanyang blood pressure. That is, hindi lang single yun, meaning ito yung madalas na makuha sa pasyente during the visit. So it can be classified na as hypertension stage 2. Again, the usual or the normal is 120 over 80. Okay, another term, the difference between systolic and diastolic pressure is termed pulse pressure. So yung pulse pressure, it should be determined after the blood pressure is measured because it reflects the stroke volume. Again, pulse pressure reflects the stroke volume. Ano naman yung stroke volume? This is the volume of the blood ejected with each heartbeat. Okay, so yung difference between systolic and diastolic, that is the pulse pressure. Remember that. Blood pressure may also vary depending on the positions of the body and of the arm. So blood pressure in a normal person who is standing is usually slightly higher to compensate for the effects of gravity. So kung nakatayo, somehow mas tumataas yung BP kasi nga because of the influence of the gravity. While blood pressure in a normal reclining person, or for example, nakaupo siya, that is slightly lower because of the decreased resistance. Usually, pinapaupo natin sa patient when we are getting the vital signs. I mean, blood pressure. Now, how do we assess the blood pressure? It is measured with a blood pressure cuff, a sphygmomanometer, and a stethoscope. So the blood pressure cuff consists of a bag called bladder that can be inflated with air. So this is the ito yung blood pressure cuff and bulb. So this is the bulb. Ito naman yung cuff natin. Tapos other part, we have here the valve. Ito yung ino-open and pino-close natin kapag ka i-release, for example, i-open na natin kapag ka i-release na natin yung pressure. And then i-close kapag ka pinapump na natin itong valve. Okay, so this is the blood pressure cuff and bulb. Next, tapos may tubing tayo definitely. And then the letter B, this is the bladder. Ito yung bladder inside the cuff. Again, this is the cuff, di ba? Ito yung bladder. Okay, so ito yung nai-inflate ng air kapag ka pinapump natin si bulb. Now it is covered with cloth and has two tubes attached to it. One tube connects to a valve that inflates the bladder. A small valve on the side of this valve traps and releases the air in the bladder. So in this case, so ito yung tube na yon. Ayan. So ito yung nakakonect sa bladder. Next, the other tube is attached to a sphygmomanometer. The sphygmomanometer indicates the pressure of the air within the bladder. So, in this case kasi, andito yon, ito yung tube eh. Okay, kaya lang, hindi na ipakita dito sa picture yung sphygmomanometer. Okay, yung parang gauge na tinitingnan natin. Ito siya, here in this picture, kita siya. Itong bilog na to, this is the sphygmomanometer. Okay, ito yung ginagamit natin para mabasa yung pinaka-blood pressure ni patient. So again, sphygmomanometer indicates the pressure of the air within the bladder. So there are two types of sphygmomanometers. Actually, three nga, ano. You have the aneroid and digital. So this is the digital. Ito yung pwede nang gawin kahit sino. Okay? And then, pero definitely, in the hospital, ang madalas na ginagamit natin is the aneroid sphygmomanometer, this one. So, ito, we also have mercury sphygmomanometer. Ito dati, ito yung dating ginagamit pa. Pero the usual now is the digital and the aneroid. Okay, so blood pressure assessment sites. So the blood pressure is usually assessed in the client's upper arm sa ating using the brachial artery and a standard stethoscope. So as a nurse, definitely dapat sanay ka kung paano gamitin yung stethoscope in getting the blood pressure. So when taking a blood pressure using a stethoscope, the nurse identifies the phases in a series of sounds called the Korotkov's sounds. So if we use stethoscope, meron tayong maririnig na sounds when we take the blood pressure, and this is called the Korotkov's sounds. So there are 5 phases, okay, but it may not always be audible. So merong 5 phases, pero pwede namang hindi lahat yon is audible when you take the patient's blood pressure. So the systolic pressure is the point where the first tapping sound is heard. So yung systolic pressure, that is the phase 1 of the Korotkov's sounds. Again, yung unang narinig mo, pagka-release mo ng pressure sa bladder ng cuff is the phase 1 of the Korotkov sound, and that reflects the systolic pressure. And then the diastolic pressure naman is the point where the sound become inaudible. Yung huling sound na narinig mo bago yung total silence, that is the phase 5 of the Korotkov sounds. So let's see. So for example, here, so usually hanggang 140 or 160 yung ating pinapump sa ating gauge or doon sa pinaka-sphygmomanometer. So again, for the phases, phase 1, the pressure level at which the first faint, clear tapping or thumping sounds are heard. Ito yung unang kung saang tumapat sa ating gauge or pinaka-arrow yung yung number. For example, yung first sound ay narinig mo dito sa 130, then that is phase 1, and that would be the systolic pressure. So these sounds gradually become more intense to ensure that they are not extraneous sounds. The nurse should identify at least 2 consecutive tapping sounds. So kapag una mo narinig, so magtutuloy yun, just to be sure na that is talaga the systolic pressure. So, you have to take note kung saan mo siya unang narinig. Or for example, inangat mo yung pressure up to 160, tapos narinig mo yung unang sound sa 140, then that would be the systolic pressure, and that is phase 1. So yung phase 2, the period during deflation when the sounds have a muff, whooshing, or swishing quality. Phase 3 naman, the period during which the blood flows freely through an increasingly open artery, and the sounds become crisper and more intense, and again assume a thumping quality but softer than in phase 1. Phase 4 is the time when the sounds become muffled and have soft blowing quality, and phase 5 is the pressure level when the last sound is heard. Actually, ang pinakamahalaga natin talaga is the phase 1 and phase 5. The systolic pressure and the diastolic pressure, meaning phase 1, ito yung unang sound na narinig mo, and that would be the systolic pressure, phase 1. And then yung last sound na narinig mo, kung saan man tumapat sa number na yan, that is a diastolic pressure. And then, pagka total silence na yung next, then you are sure na that was phase 5. Okay, so these are Korotkov's sounds. or I mean, this is the Tokarev sound, okay, yung 5 stages. So, I have included again here the checklist in assessing blood pressure. So, we will discuss our checklist, yung gagamitin nyo for return demonstration later on. So, we're done with the 4 vital signs. The 5th one is about pain. So, let's talk about pain. So, what it is, whatever the experiencing person says it is, and existing whenever he or she says it does. Another definition of pain is that it is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. This is also called as the 5th vital sign, so pain. Now, when pain is present, it is important to identify the location, intensity, quality, duration, and any alleviating or aggravating factors to the client. So the pain intensity measurement tools such as a 1 to 10 Likert scale may be used. Ito yung kadalasan ginagamit natin. Yung 1 to 10 Likert scale wherein we ask the patient gaano po kasakit yung pain. Paki-rate nga po, 1 being the lowest pain and then 10 being the highest, meaning very painful yung 10. So pag sinabi niyang 5, so you document that as 5/10 as the pain scale of the patient. So that's the pain intensity. Pain quality naman may be described as dull, sharp, radiating, or throbbing. So yan yung pwedeng maging description the patient when it comes to the quality of the pain. And then we have the mnemonic device by the cold spa, which can help you to remember how to further assess pain if present. So these are the other terms related to pain. So pain threshold, this is the amount of pain stimulation the person requires to feel pain. Or in other words, this is the point at which a stimulus becomes painful. So ito na yung point kung saan yung naramdaman mo ay pain na. Okay? So that is pain threshold. Yung iba, mataas yung kanilang pain threshold. Yung iba naman is very, very low. For example, na kurot ka lang ng very light sa isayo is very painful na, pero sa iba ay wala naman. So that is pain threshold. Pain tolerance is the maximum amount and duration of pain that an individual is willing to endure. Source of pain, radiating pain. So radiating pain is perceived at the source of pain and extends to the nearby tissues. So ito yung sinasabing nagra-radiate yung pain. Ibig sabihin, nag-extend yung pain sa nearby areas or nearby organs or tissues. Nagra-radiate. Referred pain, this is when the pain you feel is one part of your body is actually caused by pain or injury in another part of your body. And then intractable pain, pain that is highly resistant to relief. And then phantom pain, painful perception perceived in a missing body part or in a body part paralyzed from a spinal cord injury. So these are the sources of pain. Now, we have pain assessment tools. So there are many assessment tools, some of which are specific to special types of pain. So in choosing or in identifying for ano yung pain assessment tool na gagamitin natin, we have to select based on how the patient understand the pain scale or pain assessment tool na gagamitin natin and how reliable and valid yung gagamitin natin. Kasi medyo madami sila. So, for example, we have here the visual analog scale, numeric rating scale, numeric pain intensity, verbal descriptors scale, graphing rating scale, verbal rating phases, pain scales. So, again, these are the pain assessment tools. So, ito yung sample niya. So, visual analog scale. So, a 10 cm baseline is recommended for vast scales. So, no pain yung one end and the opposite end is pain as bad as it could possibly be. And then another example is a numeric rating scale, NRS. 0 is no pain, 5 is moderate pain, 10 is the worst possible pain. So parang ito yung sinabi ko sa inyo example kanina. Okay, sa numeric rating scale. Tinatanong natin sa ating pasyente to rate kung gaano kasakit. 0, yung no pain. 5 is the moderate and 10 is the worst possible. So ito yung common na ginagamit natin. So numeric rating scale. And then we have verbal descriptor scale. So no pain, mild pain, moderate, severe, very severe, and worst possible. So tinatanong natin si pasyente kung alin dyan. And then the universal pain assessment tool. So ito may mukha lang siya. Okay? Just like itong sinabi natin kanina, the numeric rating scale. So that is the universal pain assessment tool. So 0 is no pain, 5 is moderate, and then 10 is the worst possible. Tapos yung may mukha is the Wong-Baker Facial Grimace Scale. So 0, ito yung masaya siya, walang pain. Mild is 1 to 2, moderate ranges from 3 and 4, tapos 5 and 6. Severe is from 7 to 8, and then 9 to 10. Okay, so ito again, yung universal assessment tool for pain, which is the numeric rating scale. Ito, the numeric rating scale, ito yung ginagamit natin. And then kapag may mukha, ito yung Wong-Baker Facial Grimace Scale. So, ito yung mga translation lang in different countries according to their language. Now, how do we assess for pain? So, during examination of the client, remember these key points. You have to choose an assessment tool, reliable and valid to the client's culture. Kung ano yung acceptable sa kanila. Explain to the client the purpose of rating the intensity of pain. Ensure the client's privacy and confidentiality. Respect the client's behavior towards pain and the terms used to express it. And understand that different cultures express pain differently and maintain different pain thresholds and expectations. So magkakaiba tayo ng pain tolerance, pain threshold, pain level, and culture when it comes to how we perceive pain. So we have to respect. As a nurse, dapat mahalaga, or dapat alam natin yung mga bagay na yon. Now, for the vital signs taking na for our return demonstration, these are the equipments that you have to prepare. Thermometer. Kung ano yung thermometer na available sa inyo, could either be mercury in glass, oral, pero hindi na ito masyadong ginagamit. Axillary or rectal thermometer. Ang madalas ngayon, you have the electronic thermometer. And then, if you have tympanic, okay lang din. Protective disposable covers for a type of thermometer use if meron. Aneroid or mercury sphygmomanometer or electronic blood pressure measuring equipment. So, kung ano yung available sa inyo. Kung merong electronic, kung merong aneroid, you may use that. So, ito si aneroid. So here we have the thermometers. And then you have the stethoscope here. And then watch with a second hand. So gagamitin natin yung watch while counting for the respiratory rate and pulse rate. Okay? So those are the equipments. Now, I'm going to discuss the checklist that you will be using for your vital signs taking return demonstration. So in this PowerPoint slide, I will give this to you. I have included here several YouTube video where you can see kung how do we take vital signs to our patient. So it's up to you kung ano yung ipapattern nyo, but this can serve as your guide on how you can accomplish your vital signs taking return demonstration. So I will discuss the checklist to you personally. So I hope that you have learned something from this discussion about vital signs. So thank you and God bless.